Well, today our friend Naomi Wolf gives us an update. She joins us again. And of course, she's been out there spitting fire for many months now. And I'll be curious to hear what she thinks about the work of MAHA and the recent announcement on acetaminophen and where this is all going. And then we'll have Nick Hulscher in here. Of course, he's a researcher. He works with the Macaulay Institute, and he is going to give us an update on some of the data he's been working on as it pertains to some of the concerning effects of the vaccine, which continue to pile in, as well as I'd like to get some information on him on how we are addressing the adulteration of our publication, our medical publication. I heard RFK Jr. say he was not going to allow NIH funds to fund studies that were published at New England Journal and Lancet, and I forget the third journal he mentioned. So we'll get right to it after this. Stay with us. Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say. I'm excited to bring you a new product, a new supplement, Fatty. I take it. I make Susan take it. My whole family takes it. This comes out of, believe it or not, dolphin research. The Navy maintains a fleet of dolphins, and a brilliant veterinarian recognized that these dolphins sometimes developed a syndrome identical to our Alzheimer's disease. Those dolphins were deficient in a particular fatty acid. She replaced the fatty acid, and they didn't get the Alzheimer's. Humans have the same issue. And we are more deficient in this particular fatty acid than ever before. And a simple replacement of this fatty acid called C15 will help us prevent these syndromes. It's published in a recent journal called Metabolites. It's a new nutritional C15, pentadecanoic acid it's called. The deficiency that we are developing for C15 creates something called the cellular fragility syndrome. This is the first nutritional deficiency syndrome to be discovered in 75 years and may be affecting us in many ways, and as many as 1 in 3 of us. This is an important breakthrough. Take advantage of it. Go to fatty15.com/Dr. Drew to receive 15% off a 90-day starter kit subscription, or use code Dr. Drew at checkout for that 15% off, or just go to our website, drdrew.com/fatty15. All right, so let's welcome Naomi Wolf in after I give you the particulars where you can find her. Of course, she is on naomiwolf.substack.com. She's on X, Naomi Wolf. Daily Cloud on X. Be sure to follow that as well and get the Pfizer papers. Pfizer's crimes against humanity, which she has been preaching out there in the world. Naomi, welcome back.
Thank you so much for having me, Dr. Drew. It's always a pleasure.
So let me frame the Tylenol story for people so they can understand it. I got a little carried away in that episode with Corolla. I misspoke a little bit there. Of course, that'll probably go viral. So Tylenol is acetaminophen. If you were to take 15, certainly 20 500 milligram tablets in a single sitting, you would cause irreversible liver damage and hepatic necrosis, and you would die. So Tylenol is not without risk. Now, for the most part, it's fairly benign. I was just trying to figure out why the Europeans use paracetamol and not acetaminophen. Maybe it's the same thing, just a nomenclature problem. But I'll look into that at a later date. But we have a signal that actually was identified first in 2017 by the Tylenol manufacturer that pregnant women shouldn't be taking Tylenol. And they said it could add to neurodegenerative disorders like ADHD and autism. And we have a mechanism now. Marty Makary came out there and said it's glutathione depletion, and they've got an idea, sort of a workaround, leucovorin, to help kids who might be having these problems. But in any event, it's a first signal. What did you have a take on that? And how about the fact that there are pregnant women out there on TikTok taking doses of Tylenol in this weird opposition to Trump? It's Trump derangement writ large, but I'll let you comment.
Sure. It's just heartbreaking that we're in such a stupid time, Dr. Drew, where stupidity prevails. And it's dangerous. I want to say two things. I'll start with the second one. The fact that there's a signal from Tylenol that this FDA and HHS has disclosed to the world with this very high profile set of events, especially related to autism in pregnant women, should just be what the FDA and HHS is supposed to do day by day. It shouldn't be controversial. If they've got evidence, and it's my understanding before I came on the show, I checked and like 2 clicks in, they didn't just stumble on a study or do their own study. There have been over 40 studies, from what I understand, showing that there's a negative signal from Tylenol ingredients on pregnancy. So this should be just another day at the FDA. If we had a functioning public health apparatus and a functioning electorate receiving public health information. So now we've kind of got I would say 80% functioning public health apparatus, but we don't have non-insane American citizens. Whether it's the vaccine or the propaganda, brain damage from the vaccine or the propaganda of 4.5 years or the isolation of the lockdowns, the fact that pregnant women on social media, and I think this is very whipped up, I don't think it's organic, right? But the trouble with a wave of propaganda is it starts out artificially sparked, and then people just follow suit and show where they stand. I'm also going to take aspirin. I will show that I'm pregnant. It is, profoundly disturbing, because people are not thinking critically, which we certainly saw with the whole vaccine rollout and the inability of otherwise sensible people to ask questions or listen to information, contrary to what public health dicta were saying. But the other reason it's disturbing is that, we've all known for 70 years that pregnant women aren't supposed to take anything. Like, this is not news. And so why is this even a discussion? It's insane. Yes. Like, whatever it is, unintended consequences, a study we haven't found yet, maybe nothing. You're not supposed to take anything. So the fact that I'll just wrap up this part of the rant by saying the fact that pregnant women are on video taking any medication at all, to me, shows the horrible damage to the sanctity of pregnancy, in a medical context, in a social context, that was done by the COVID vaccines. And then when you're ready, I'll tell you my first part of the answer, which is political.
I can't wait. But let me just say something very quickly, which is I so agree with you about this should be normal function of the public health infrastructure, which is advising doctors how to use medication. No mandate here. No, you can't have acetaminophen. Nothing like that is happening. People, I need to shut the fuck up. I'm sorry. People need to shut the fuck up thinking that I'm not going to get my Tylenol. So if your doctor thinks that you need Tylenol because the fever is endangering your fetus or your migraine headache is so severe you're going to kill yourself, whatever it might be, by all means, the risk reward is there to take the Tylenol. By all means, and any of your physicians, your obstetricians will probably tell you that you should be doing that. But here's the ultimate irony, Naomi, you're going to love this. So there is one medication that the American College of Physicians, in their rheumatology board review, recommend that women continue during pregnancy because it is so inert. It is literally the only medication I have ever seen a professional society like that saying you should keep the women on this medicine if they have lupus, and that medicine is hydroxychloroquine because it is so inert. Isn't that incredible? Yeah. And yet this weird pushback on acetaminophen is harkens back to ivermectin and hydroxychloroquine when people who are now have opinions about Tylenol and the signal that was seen in the science had opinion about ivermectin. They should shut up. Shut up. There's no reason you should have an opinion about that. Just listen to the recommendation of the CDC, talk to your doctor, let your damn doctor do his or her job. Sorry. Go ahead, Naomi. Now your turn.
Very disagree with you.
Okay, please.
My good friend.
This is where we're good.
We have good disagreements. I don't agree, especially that women should passively just shut up and listen to their doctors and take their doctor's advice. I would rephrase that and say
that wasn't what I was saying. Yes, I wasn't. I didn't mean to sound like that. That was not what I meant. So thank you for clarifying.
Even just privileging the opinion of one's doctor. It would be wonderful to live in a world, it was a beautiful world in which one could just consult one's physician and trust that one was getting completely objective, highly qualified advice.
You're right.
That's not the world we're living in right now for a lot of reasons.
It's a good reminder for me. Yep.
So I would definitely say, we've learned from the last 4.5 years, everyone should do his or her own independent research, ideally getting used to reading scientific papers, which people are told, oh, you're not a doctor, you're not a scientist, you can't understand this. With a little practice, people can understand scientific papers, especially with summaries, which they all have, or with AI, which can explain it to you very simply. So I really do appreciate what the administration is doing, and this is part of part two, which is they are using their bully pulpit in a very effective way. They can't deliver all the things that all of Maha wants, obviously. But what they are doing is saying, here's some information. And which is what they're supposed to do. That's the bully pulpit. It's one thing if they were just saying, this is our insane opinion and we're lighting, some incense sticks and worshiping the full moon. But they're saying, here, I wish they would do it more. Here are links to the data. Here are the studies. This is what the evidence shows. Yeah. Good for them. That's what they're supposed to do. But I guess what I would also say is that there is a political component here because, Maha has been out for, I don't want to say out for blood because that's too strong and kind of scary, but very aggressively, including me, wanting action on the COVID injections and very upset that the last announcement about the COVID injections from Marty Makary specifically, as I recall, had carve-outs for pregnant women and for sick kids as still recommended to get the COVID shots. And this was in a lot of tangled up verbiage that you had to parse quite a bit to understand, but it was definitely there. My colleague Sasha Latipova and Dr. Mary Bowden helped to tease that out. And, we wrote a very stern letter about it, a public letter. So that the awareness that the COVID shots have been particularly damaging to pregnancy is out in the world. And I also understand, again, as a former political consultant, that it's virtually impossible, if not very, 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 very difficult to say honestly right now in history, maybe someday it'll happen, the time's not there yet, from the HHS pulpit or the White House, these have been horrible for pregnant women. This is why so many women's menstrual cycles are destroyed. This is why there's a collapse in fertility and healthy live births. This is why maternal mortality is up 40%, all of which is true. They can't say it. Part of why they can't say it is that it would usher in a massive flood of litigation from which Pfizer would never recover, Moderna would never recover if it's the same mechanism. And partly because the litigation could sweep up President Trump, who was the author of Operation Warp Speed and who was in charge when he greenlit, this, at least this research. He was gone by the rollout of the injection. So I understand, I'm not judging that reality. That's a real reality that advisors to President Trump and to RFK Jr. and to Marty Makary, if they're doing their jobs, are warning about, right? And their lawyers should probably be warning about it also. It's very real. In such a climate, I also understand there is symbolic substitution. And what I see here, again, reading as a cultural critic and political consultant former, is let's do something else about something hurting pregnant women. And almost, I don't want to say a distraction, but people are symbolic interpreters of meaning. And it is kind of a gesture toward the damage to fetuses, the damage with miscarriages, spontaneous abortions, menstrual cycles, all of the horrible damage. We talked about the collapsing birth rates. To have a display, which is really quite toothless if you look at it, to your point, they're not taking away the Tylenol, but a very big public kind of spectacle to say, oh, this is a danger of a thing that you put in your body during pregnancy that can harm your baby. It doesn't really, it's kind of a slap on the wrist to the makers of Tylenol. They haven't done anything wrong. They haven't. They warned people. Apparently, they never pushed it on pregnant women. I mean, maybe there's a paper trail of a campaign like the horrible campaigns for the COVID shot showing them trying to push on pregnant women, but I doubt it. They seem to have behaved with a fair amount of integrity. So it's a kind of smart political substitution of a gestural shame on you, naughty, naughty manufacturer of a pharmaceutical product, and ladies, protect your babies, and HHS is standing up to protect you and your baby. Now, having said all of that, it may well be that this is one of the reasons autism has been spiking, in which case I will eat my words. I just don't think there's enough evidence yet for us to know, but if there's a chance, and certainly the adjuvants, Illumina, that has to have a horrible effect on babies' brains and fetuses' brains. So good for them. But if it turns out that this is action that is really going to drive down the horrific rates of autism in this country and in the West, it's not distributed identically around the world, which I think is very interesting. I think it's part of the attack on the West to to make men particularly emotionally obtuse, to destroy the family. I'm sorry, that's a mean thing to say. To make men, to blunt their emotional sensitivities helps to destroy the family, and to create kind of more technocratically aligned humans, right? It would be in alignment with the whole transhumanist attack, from China, from the globalists. But if this intervention really does save our boys and girls from that horrible, horrible condition, God bless HHS and the FDA.
So I have a couple of questions. So first, I got to practice how I should have said that to make sure you keep me honest about when I was telling people to fuck off or talking about the acetaminophen. I really wasn't talking about women per se. I was talking about people with Trump derangement who suddenly feel they have a scientific pharmacological opinion about something that they know nothing about just because Trump said something. Let the CDC and the HHS send out their advisory and let physicians decide what they want to do with that. Period. End of story.
Let moms read the advisory. Let moms and dads click through to the underlying papers. By the way, sorry to interrupt, but a mistake that this administration makes all the time, especially HHS, is they don't link the studies. In a digital world, there's no reason not to link the studies. So I hope
that's interesting. Okay, I'm going to talk about Acharya soon. I'm going to bring that up with him, and then the other thing. What was I going to say about that I would say you're right. I forgot about COVID, the experience of COVID for a couple of seconds there, but you brought me right back into focus with that. Let me at least say physicians and patients should be making these decisions together in an informed way, thinking about risk reward. So the other thing I want to know is, did anybody whisper this to you, that's why they were taking the position on pregnancy and sick children? No, you're reading into it. I got it.
Yeah, it's just my
okay. It's very interesting. I like it. And then finally, I have been very focused on mandates. I think the mandates are truly where things got off the rail completely. And I love that Joe Latipo is going to take away mandates and let doctors and patients make their decisions together about what they're going to take and when they're going to take it. And it shouldn't be in the hands of the government, particularly given how weird the recommendations have become, so many of them. I mean, hepatitis B is the one I keep talking about. And again, it's just a weird one. I was looking at all the data. I mean, there is such thing as chronic hepatitis B. It exists almost only in immigrants who come from Asian endemic areas and IV drug users. And guess what we do with those people? We screen them for hepatitis B. And guess what? If they're household contacts, they get the vaccine. And guess what? If it's a pregnant mom, that baby gets the vaccine. That's the only people that need the vaccine. That's it. That's it. And the fact that there is a non-zero risk of that vaccine and effectively zero benefit, I can't imagine why we give that on day one. But to me, it's an example of the kind of thinking that's gone into vaccine therapies.
Right. I am not a doctor, a scientist, but common sense also keeps nagging at me as, as a mom and stepmom, which is if babies are getting 72 injections by the time they're school age, right? I mean, vaccines. Then that's a lot of adjuvants. That's a lot of, whether it's aluminum, whether it's other, heavy metals. I don't know if lipid nanoparticles are used in other vaccines other than the COVID vaccine, but whatever those adjuvants are, that's just a lot of liquid that is not part of the human body that is potentially damaging to pump into the bodies of small people and to cross the blood-brain barrier. Sorry, my dog likes to
and so let me sort of scratch on your cultural criticism, which is that we have entered a phase where medicines and pharmacological interventions make life better in the eyes of the American public. Make life better. That is not what they are designed to do. They are designed to address disabling and fatal illness when the risk reward warrants it. Period. End of story. I've told this story, it seems like I'm telling it every day now. My dad was an old family practitioner. I did not take an antibiotic until I was 15. And I remember that day, he brought home some samples and he was like, all right, here we go. You're going to take it. Your pediatrician thinks I don't know. It's just, why you would take anything. You're a healthy young, man. Why would you take medicine? Medicines are all dangerous, all 100%. Every medical intervention, including walking into my office, it has risk. And that risk better be warranted or we should not be doing it. And there's essentially no circumstance where pharmacology, where molecules make us flourish. It treats illness that then allow us to flourish. But this idea that medicine makes life better is a really serious cultural shift that has to be addressed.
That's a really profound, super smart thing to say, Dr. Drew.
Good. Go wild. Go wide with it. Take it. Go
forward. Whenever I try to kind of look at what's really happening with, medicine and public health, I tend to kind of take a wide view from my 400 years of reading English literature and memoirs and letters and so on. I often mention this. Because not being a scientist, that knowledge base is incredibly useful because you can see how people actually dealt with illness and thought about illness, for generation after generation in the West. And I guess what I was thinking about when you were talking is, wow, that's correct. Like literally no one in Jane Austen novels is saying, well, Elizabeth, let's go see, our family doctor to get a pill or an intervention or like what did they used to use? Maggots. What were those? Like, not maggots, the other ones.
Leeches.
Leeches.
The slugs.
We just want to feel a little bit
Leeches,
better. No, they took interventions when they were actively ill. They engaged in a lot of prevention to avoid becoming ill. Go ahead.
And at the same time, we've stopped doing the things that humans need, which is relationships and meaning making and stability and contributing. That is all a wasteland. And the young males are the ones suffering, as you've already pointed out. I know you're advocating for the women, but men are really in trouble. And they want guidance. They want spiritual guidance. They want to make meaning of things because that's what humans do. That's how they flourish. So, and it's not in a pill ever. There are real illnesses. You have to take a medication, that they exist. Believe me, everybody, here's another thing. This is the flip side of this, Naomi, is every one of us and everyone we love will eventually get sick. That will happen. And it's just the nature of being a biological agent. And when we do, we want to use our pharmacological interventions rationally and to best risk-reward effect. That's it. But in the meantime, when you're healthy, you should just make meaning out of life and enjoy yourself, not look for a pill to make things better. How are people receiving your messages? I've seen you out there a million places lately. How is it going with you've been talking, it seems to me you were talking particularly about the Pfizer papers and the big shortfalls on those studies. How have people received it?
Well, it's been satisfying, Dr. Drew. I definitely feel like the culture has shifted, as I mentioned. I think the word has gotten out, certainly in the United States. The censorship worldwide, but especially in the West, of our work on the Pfizer papers, which your audience knows what it is, 3,500 doctors and scientists going through the 450,000 records released by Pfizer under court order, and the 109 reports showing the worst crime against humanity ever. The censorship is so bad that I've been literally airlifted to Iceland and to the Netherlands and, a cruise ship along the south coast of the Mediterranean where I could speak freely to people because there were no laws, about speech on the cruise ship.
Yeah.
Literally, I have to physically go into spaces, again, like in the 19th century, like before the telephone, before the internet, to communicate this information. But it's getting out. And I was very honored a few weeks ago to have been brought to the European Parliament by the wonderful MEP Christine Anderson of Alternatives for Deutschland, the nationalist party. And I
She's a friend of ours.
Yeah, she's so wonderful. And I presented to 70 MEPs the findings in the Pfizer documents. So, and then very satisfyingly, Ursula von der Leyen tried to crack down on misinformation after my visit, and now she is acknowledging that Pfizer was not thoroughly tested. So I do feel like we moved the goalposts, or we moved the ball down the goalposts.
Congratulations. I saw that. I saw you there. I didn't realize that Christina had brought you in, and she's the one that kicked out Trudeau from the EU and insulted him and kicked him out, if you remember. That's I saw her and I got to talk to this woman. This is the best thing ever. And she has remained, there are fire breathers out there here and there, and she is one of them. For
sure. She's a historic figure. Absolutely. I was very honored to have met her. But overall, politics, it's one step forward, one step back. I have been very frustrated with this administration because we literally aligned MAHA and MAGA to do a couple of simple things that still are not done. Some positive changes have been made. I think that I don't know enough about the personnel information, but I'll just say generally, I think some personnel shakeups at HHS that led to people who were not so useful leaving, and at least really good communications stepping in. The comms are a lot better than they were. I'm not sure exactly who's responsible for that. I think there's a new chief of communications, but I'm not sure. But that's a relief that the communications are better. They still, though, Dr. Drew, if I'm going to be, uncensored here, which is wonderful, as I always am, they still at HHS tend to, it's like death for communications. They tend to be convoluted and kind of morally wriggly in their speaking to the American people. The American people notice, they notice if there's a conflict of interest, which is a focus that I've had when I've been critical of certain activities at HHS. If people have private companies that are making millions or set to make millions from certain recommendations, specifically, I'm not being obscure, wearables, the Means twins both have companies that harvest biometric data. So, you want to disclose that conflict, you want to recuse yourself from policy making that involves a conflict. That's how we used to do business when, my husband was at the Clinton White House. And then when I was a political consultant, you can't profit from what you're recommending to the American people. It's very unethical. And I don't think it's, well, I'll just stop there. It's unethical. So I wish they wouldn't do that. And then even with the announcements, there's often, the example of the COVID, big statement. I don't think you and I have talked about this.
Yeah.
Big rollout. Well, there were those very damaging carve-outs, and anyone perceptive, are going to pick those out as we did. And those are bad carve-outs. And it would be better to be honest with the American people and just say, look, we're doing the best we can. We're going to warn you guys. There's so much opposition. It's very difficult to, give you a home run. We can't take it off the schedule yet, but we're warning you about it. Like that, I think the American people would respect that more than a claim that they had, quote, removed, or whatever language they use, the COVID vaccine, but in fact we're still recommending it for pregnant women and sick kids. It's just people can smell a lack of integrity a mile away, even if they don't have the skills to kind of tease out all of the flavors of the lack of integrity. And, you know, I love RFK Jr. I love Jay Bhattacharya. They are two of my favorite human beings. I don't know Marty Makary very well, but that's not why people adore them. You know, that voice, the reason people adore them and follow them is that they're so honest and they're so uncompromising. So I'm not sure why their honest, uncompromising voices are not prevailing in the messaging from HHS. I can imagine why. There's a lot of, you know, strictures. There's the White House, you know, a whole other staff. I mean, I was right in the middle of warring camps, you know, when I was advising the president and then the president's team, and then the vice president. It's not easy when there are multiple camps to satisfy, and they don't always have aligned interests. But I think it's very important for President Trump to get thoroughly behind RFK Jr., which he seems more and more to be doing, which is exciting. Because not just for moral reasons, but for political ones, no one can win in the next election without the Maha voter. And the equivocation and the self-dealing of people around RFK Jr., you know, in terms of these conflicts of interest, are going to push away those moderate female suburban voters that made all the difference, never would have elected Trump, never would have voted for Trump without the HHS addition and RFK Jr. And it's so important for both teams to get everything on track and not kind of smell like opportunism, you know, so that there can, if they do that, Dr. Drew, MAGA and Maha will win and win and win and win, and there will really be no reason for a Democratic Party, you know, of any real opposition.
I'm going to make a prediction that I think I'm going to do some research, see if I can find out whether or not I'm right. But you need to know what, you know, RFK Jr. keeps talking about gold standard research. And so my question is, what is the threshold he's using to determine what is this gold standard research? And my suspicion is, what is that noise? Is that you guys?
I'm so sorry.
That's something I should know about? It's okay.
No, it's me. I don't know how to turn it off. Sorry. I'm here without my husband.
No big deal. But
be feminist, you can't do technology.
I blame him. I blame your husband.
I'm going to text him and yell at him.
So, but the threshold for that gold standard research, we all need to understand what that is, because I'm suspicious that they're being very careful to roll out their definitive positions only based on achieving that standard. And when it comes to the vaccine research, well, you have that reaction, but hang on, please go. But when it comes to that standard, my suspicion is he wants to do, double-blind, placebo-controlled studies on the vaccines, and then say, now that's it, we've got it. But that'll take a few years. Go ahead, have your reaction.
Okay, so I have two things to say to that. I mean, one is, this is happening on social media. Every time someone at HHS says, we need, more studies before we can boot the COVID vaccine, someone posts the image of our book, the Pfizer papers, because that's 500 pages with full color illustrations of studies, or documentation from Pfizer showing how dangerous it is. Pfizer did the studies proving how dangerous it is. The FDA has all that information because Pfizer gave them all the records showing how dangerous it is. The 1 8-page document alone, Dr. Drew, the Pregnancy and Lactation Report, which went to the Biden White House on August 20th, 2021, right before Dr. Walensky announced to the women of America that there's no bad time to take your COVID vaccine before you get pregnant, during your pregnancy, or after your baby is born. That alone, it's like a proof point that Pfizer was giving the White House that they were able to kill babies in utero with this injection. So Pfizer's done the research. They did the research. It was on the basis of that research that they claimed the right to get an EUA. So how are you telling me now, I don't mean just you personally, I mean Dr. Makary, that research is not relevant? All of us were mandated and coerced, and 2/3 of us were subjected to this on the basis of that research. We have the research, and the research shows that it's deadly dangerous, and that it has, tens, 43,000 serious adverse events. It's often multiple serious adverse events in a single person. So no, you don't need more research, number one. I mean, it's always good to have more research, but Pfizer did the research.
For the pregnancies, for pregnancy particularly.
Everything. It's 450,000 documents of, is this safe? Is it effective? No. It causes this damage. Causes that damage.
Don't let Trump talk about it, though. Whatever you do.
Why?
He's not good.
Oh, because people will then, if he says they're unsafe, then everyone will run out and get it if he says it's unsafe.
Right. Oh, I see.
So yeah, he needs. Yeah.
So
oh my gosh. Maybe that was a diversion, a test run.
Naomi, go ahead.
Sorry. Well, also he's, I think he can't talk about it because of his legal jeopardy. He was in charge of the role.
I hear you.
But number two is, you can't have a double-blind study because it would be unethical. At this point, giving one more COVID shot to anyone is unethical.
Oh, I see what you're saying. Yes, I think COVID is kind of a special case, and I just was curious if the studies that Pfizer did meet his notion of gold standard study, and if they do, why isn't he using your? I know what you're thinking, but I'm wondering if that's what's delaying it, or are they just unaware of your material? Well,
no, they're certainly aware because some people in the administration keep ripping it off without crediting us, which is, another unfortunate subject. The people who cite it, including several people at the AKIP hearings, were referencing stories that we broke, like the biodistribution fact. We broke that in 2023, and the cover-up of myocarditis. Our lawyer, Ed Berkovich, FOIA'd that information, broke that story in 2024. But no matter what, we just don't get cited. I mean, I don't want to dwell on this because just a personal frustration on behalf of these 3,500 people who worked for 3 years with no pay to, help the world save humanity. So they're well aware, And these are friends of mine, like I know Jay Bhattacharya. I know of
Okay, good. Okay.
I've had Dr. Malone over, to my events. I mean, they know where to find me. My publisher is their publisher. There's no justification, and I've got a donor who had us mail the book to, everyone relevant up and down the chain of command. So no, and Bannon published the book, right? I mean, Steve Bannon orchestrated the whole effort. So there's literally no excuse. And your friend, Tony, God bless Tony Lyons. I mean, I'm not trying to wash dirty laundry in public, but he's my publisher. He's also on the MAHA, team advisory board, MAHA PAC. He's my publisher. So everybody's well able to get Naomi's book from Amazon. And I don't just
your frustration. Your frustration. It's interesting to me because your frustration mirrors what I'm hearing from some of the MAHA participants, and that there's information missing, in my humble opinion, about why things are not going faster. And maybe it's the legal explanation you're talking about. And that might be the piece. That could easily be. But Naomi, we got to wrap up here. We always have so much to talk about it. Maybe I'll bring you back tomorrow and keep going. I'll bring you back soon enough. But we miss you. And as always, I just thrill at the work you're doing. And I'm so grateful to know you. I'm so grateful you're out there fighting the good fight. And seeing you over at the EU was really special. So I hope they have you back. I hope your husband stops bothering you on your computer.
That was actually me.
Oh. Was you texting Naomi? Or?
I sent her a video clip. I don't know if it's true.
About the woman and the liver failure. Let me let Naomi go first, because this is a medical thing. I was just like, oh no. No, I saw this hours ago. So because I don't know if it's true or not, but we'll get into it now.
Yeah, if it is.
Caleb already put the video up. Yeah.
We look forward to seeing you both again. All right, take care. Thank you so much.
100%, Naomi. Thank you. Thank you for the work. Okay, so what Susan is talking about was the video that Caleb put up just a second ago. Was
Oh,
this
you put it
woman?
up?
Yes,
Oh, I didn't see
was
it.
this woman who is reporting a story. We don't know if it's apocryphal. We don't know if it's true or not. There's the video. There's a woman. She was contacted by the husband of a woman who's on a ventilator in the ICU right now with hepatic failure. And hepatic failure is pretty easy to induce with Tylenol. We used to say 8 500 milligram Tylenol tablets. I looked it up recently. They said more like 15 to 20 Tylenol tablets. But if you take a bunch of Tylenol one time and you don't report that, there are ways to sort of give you an antidote that undoes the problem. But if you don't take that antidote and 3 days go by, you are dead, period. And then maybe a liver transplant, sometimes we can do that, but that's unlikely. So it's a fatal, it's one of the most horrible ways that people commit suicide. They just take a bunch of Tylenol and then they show up 3 days later at the hospital in extremis. They're gone. Now, somebody's asking on TikTok, what can a pregnant woman do instead of Tylenol? If a pregnant woman has a very high fever that's endangering their baby, they should take Tylenol. It's worth the risk reward them. If they have a little shoulder pain or something, don't take the Tylenol. Tylenol is an antipyretic, anti-fever, and an analgesic. The pain, now you could argue maybe an opiate is actually, an opiate rather, would be safer, but all the opiates that are available to us, to doctors, are complex with Tylenol. So you're giving the patient Tylenol again anyway. So, I suspect if somebody is in big trouble with pain, a doctor would probably say, take some Tylenol. And they might progress that to an opiate with Tylenol, possibly. But this is all the decision-making that goes on and why you have doctors. So there are also cooling measures you can take. Take cool showers, cold drinks. They're cooling measures other than systemic therapeutics. So there's a lot to be done here, but if your fever is sufficiently high or your pain is sufficiently severe, and you don't want to try other things and you're endangering the child, obviously the risk reward, take the Tylenol. It's not a big deal. And yeah.
Oh, sorry. So for people like me, I have Crohn's disease, so I'm not allowed to take any sort of anything. I actually can't take anything except Tylenol or opioids, which I don't do opioids. So where does that fit in for people that can't do it because of GI issues?
Take Tylenol. There's no reason you shouldn't be taking Tylenol. You.
Oh,
you're not a pregnant woman.
Okay, I'm not pregnant. I guess right. Okay, yeah.
Yes.
So it's not known to be.
Don't get weird, everybody. The Tylenol is an evil drug. All that's why I was raising the issue with Naomi. All medications are dangerous. They need to be used carefully. All medicines, risk rewards got to be there to deploy them. They should be used. I mean, if you have miserable discomfort, we have stuff for that. We can take away suffering. We can either limit disabling disease or potentially fatal disease and limit suffering. Those are things we do pretty well in medicine, but we're not going to make life, just strictly speaking, better with pharmacology. So, all right. So we've got Nick Hulscher in here next. I want to ask him the same questions I was asking Naomi about some of that data. I want to ask him why he thinks they're not using Naomi's data. It'd be interesting to find out. Talk a little bit about Tylenol and a breaking study, first direct evidence of mRNA vaccine genomic integration identified in a stage 4 cancer patient. Back with Nick Hulscher after this. I've spent most of my career dealing with illnesses that shorten life, and now we have ways to extend it and extend wellness. I've been working with the team over at V-Shred to develop a product that has everything I want in a longevity supplement. NR Boost has nicotinamide riboside. You know how metal can rust? Well, your body behaves in a similar way. It's mediated through something called NAD. NAD falls as we age, so we're less able to fight off that oxidative process. We oxidize much like that metal. And NAD fights it, but nicotinamide riboside elevates NAD so we can push back on those oxidative stressors, improving health, improving longevity. The other product is Senosync, has fisetin, one of the key molecules to fight off zombie cells, and we've added resveratrol to that, which is a well-known anti-aging antioxidant again. I don't like supplements that have a ton of ingredients. To me, it suggests that none of it's working. When I prescribe a medication, I prescribe that medicine because I expect that to work. That is exactly what I've done with these products. products. And I want you to go to drdrew.com/vshredmd for 10% off. Again, that is drdrew.com/vshredmd. The Wellness Company knows that taking charge of your family's healthcare is a top priority, and being rationally ready, and who knows what the future will hold for us. Now, TWC has a service to cover your family's medical needs, including and especially prevention. For just $100 a month, the One Wellness Elite membership includes 2 free medical-grade nutraceuticals per month, free prescriptions for over 800 of the most common medications, access to concierge telemedicine, available at a moment's notice, and a 15% discount on all supplements and the emergency kits. 15% off the emergency kits. That's quite a saving. So if you're spending $100 or more on supplements and meds every month, this plan will already save you money. If you sign up for a year, you'll save $200. And when you use the link, drdrew.com/TWC, you'll get 10% off the first payment to the One Wellness Elite membership. Check out One Wellness at drdrew.com/TWC and get 10% off your first payment. drdrew.com/TWC. It's all there.
That's brilliant. And thank you, Drew. Where's Dr. Drew? Where is he? Dr. Drew. Dr. Drew.
Well, a reminder on that TWC wellness, they have 3 different levels, and really we're trying to restore medical freedom for patients, and there's so many encumbrances in the system, and Naomi was tilting at some of it. There are also supplements there. It ends up being saving money in the long run. The One Wellness you get at drdrew.com/TWC. Again, I'm generally very proud of the work TWC is doing. Whether it's readiness with the emergency kits, or whether it's, sort of disengaging from some of the insurance encumbrances with the One Wellness. These are all things that you should look into it. Also, our friend at Paleo Valley, they are updating their amazing line of products, and they've now got a grass-fed and finished bone broth protein powder that is savory flavor, turmeric, ginger, that Susan was taking this morning, was raving about, right? Was that not true?
Oh, yeah, it's amazing.
Amazing. Okay.
Like a soup. It's so good.
Like a soup, she kept saying. And you start talking about putting vegetables in it. She had all kinds of ideas. Turmeric, of course, there are health benefits of turmeric you should be aware of. It's an anti-inflammatory, essentially. Paleo Valley uses only certified organic whole food turmeric. And of course, Paleo Valley's bone broth is made with bones, not hides. Each scoop, 7 to 8 grams of collagen protein, very important protein for the human body. We don't get enough. And also they have their new pumpkin spice superfood bars, which are delicious, made with that as a base, that same bone there it is, with other extraordinary nutrients added. Get them before they're gone. They're here just for the season. It is drdrew.com/Paleo Valley, and get 20% off when you subscribe, or 50% off your first order at drdrew.com/Paleo Valley.
It's so satisfying having that bone broth, but I love the flavor of the
ginger turmeric.
Turmeric. I actually thought it was going to be sweet, and I put it in my coffee, and I went, oh, this doesn't go in your coffee. And then I just had it for lunch.
It's a soup. It's like you said you wanted to try it in
But
tea.
I need to have turmeric in my diet because I do have joint issues.
Yeah,
So
it's not a bad idea. Turmeric's healthy, and curcumin. Dr. McCullough, we'll talk to Nick about curcumin in a second. He recommends a lot of that. Nick is Nick Hulscher.
It does have a little onion powder in it, though, if you're allergic to onions.
And I see HULSCHER, also substack.thefocalpoints.com. Nick, welcome back.
Thanks for having me.
So, as long as we're talking about curcumin and turmeric, Dr. McCullough uses curcumin a bit in some of the long haulers, no?
He does. It's part of McCullough protocol-based spike detoxification, nattokinase, bromelain, curcumin. Curcumin is a potent anti-inflammatory, but it does also block the spike protein from binding to ACE2 receptors, as well as it is a potent antiviral against SARS-CoV-2, influenza, all sorts of viruses. It's a very good compound.
All right, I'm having it every day now.
That's curcumin, though, not turmeric. Turmeric is the straight anti-inflammatory. So,
Sorry.
So he uses bromelain and curcumin. Look up the McCullough protocol.
What's the difference? Like,
they're just different. They're
are they
different
all
molecules.
like turmeric, though? Is it like a spice or?
Yes,
curcumin?
It's a spice. Curcumin's a spice. It started that way, at least. So I wanted to ask you a couple of things. I don't know if you heard Naomi talking about or expressing her frustration at the HHS not sort of using her studies in the Pfizer papers. Do you have any theory why that would be? Why they would be I mean, she's very clear on the studies she has published or the book she has put together that continuing to give the COVID vaccine to pregnant women is a bad idea. Why is that still something that is still, I don't want to say allowed because I'll never just take it away, but why is it something that seems to still be recommended?
Yeah, that's a great question. Why it's still recommended. You're right. Naomi Wolf has provided abundant evidence of the extreme dangers of inoculating pregnant women with gene transfer technology. And we have so many studies now peer-reviewed and published. One study by Dr. Thorpe, James Thorpe and colleagues, they found over 80 safety signals regarding pregnancy outcomes and vaccination, mRNA vaccination. It's linked to miscarriage, stillbirth, all sorts of things. And so it's just abundantly clear at this point. It's not safe for pregnant women whatsoever.
Did you have an opinion about the Tylenol announcement?
Yes. We look deep into what the science is behind this. So it's obvious Tylenol is bad, right? It is toxic to the body, particularly for pregnant women, obviously. We know it depletes glutathione. We know that it overwhelms the body's detoxification system, right? We know the cytochrome P450 enzymes metabolize it, which then churns out toxic byproducts, and then that binds to glutathione. So the glutathione levels will be lowered. But the key thing is this appears to be what's called confounding by indication. What that means is a lot of the times when pregnant women take Tylenol, they're taking it for a vaccine fever. They're recommended to take 4 vaccines: influenza, COVID-19, Tdap, as well as RSV. And so they get all these vaccines, they get fevers, they pop the Tylenol, right? So that's confounding. And then all of the studies that link prenatal Tylenol use to autism rely on self-reporting of the mothers saying they take the Tylenol. And then the autism is diagnosed not right when the baby's born, ages 2 to 8. And that's the time when they receive the large battery of vaccines, right? And none of these studies that found an association, there was about 8 of them, not one of them mentioned the word vaccines. They don't account for vaccination at all. So this is also a confounding variable here. So it appears, like you see there in that figure, the pathway to regression begins with vaccines as the trigger. Then the kid gets a fever, and then they pop the Tylenol. Then that detoxification system is overwhelmed, and all the other toxins from the vaccine, sometimes they get 4 at once, end up reaching the brain, nervous system. They suffer neurological damage, and then boom, developmental regression, autism.
So I did not hear, maybe I missed it, a recommendation against using Tylenol in childhood. I heard a recommendation against using it in pregnancy. Did I just miss that?
No, you didn't miss anything. You're right. That's all they recommended was against in pregnancy. Yeah. But what appears to actually be the case is this vaccination actually results in the developmental regression after they're born, or even while the mother's pregnant. It's actually the vaccinations, but they do pop the Tylenol at the same time. That's why we see major associations. So there's a lot that goes into this, but it would also be very unwise to pop a glutathione depleting product when you receive 4 vaccines at once. It's not a good idea.
Or even just in a developing human, in the rapidly developing human being, it seems like a bad idea to me. But although, again, I'd love to see the data on children per se. But you did publish recently the genomic integration study in a stage 4 cancer. Tell me about that one.
Yeah, so this is literally the first documented direct evidence of genomic integration of mRNA vaccine genetic material. So we found a stage 4 bladder cancer patient. It was a 31-year-old woman, right? So this is a very rare cancer in this age group. Stage 4 bladder cancer.
Crazy.
Yeah. So she's got this turbo cancer. And so we did some molecular profiling. looked at our circulating tumor DNA, ran some proteomics, what's called multi-omic analysis. So we looked at everything going on, but we identified in the circulating tumor DNA, and the first author of this study is Dr. John Catanzaro of Neo7 Bioscience. In this circulating tumor DNA, in chromosome 19, we identified a chimeric segment of Pfizer, Moderna genetic code, part of the spike encoding sequence from the DNA plasmid, was literally integrated in chromosome 19 in a what's called non-safe harbor region.
Hang on. I want to make sure I get this. This was not an encoded DNA from the mRNA. This was a plasmid that had infected or been adulterated in the vaccine. Is that correct?
It appears it is the plasmid because it is a perfect 20-20 base pair match, perfect 20 nucleotide pair match of the Pfizer reference sequence to this sequence in chromosome 19, which is about a 1 in a trillion chance of this being an anomaly. So we do believe it is the DNA residual contamination part of that sequence. It could be from the mRNA getting in there as well and reverse transcribing. We can't really tell exactly, but because it perfectly matches the plasmid reference sequence published online, that leads us to believe it was from the DNA contamination.
That is pretty crazy, right? And people have been ringing the bell for a while about, I think Sasha Latipova maybe more than anybody, maybe Jessica Rose also, the DNA plasmid contamination being a significant problem. And now here you have a smoking gun of a pathogenic result or pathogenic mechanism for a serious tumor. How weird to me that is the FDA raising alarms? Is somebody paying attention? Or are they still asleep at the wheel?
Yeah, they're still asleep at the wheel. They got to be acknowledging this, right? We cannot gamble with genetic alteration of humans, right? It's too dangerous, right? Even if they don't believe our case report's true, which it's a 1 in a trillion chance it's not true, or a 1 in a trillion chance that it's not true. It is. It's like probably the most solid evidence we could really get. This has to serve as a warning signal for massive investigation to see, well, how many people may it have integrated into, right? We got to start looking. We just don't know. But I think the highest risk of these integration. Yeah, go on.
Yeah, go finish your thought. Highest risk.
Yeah, I think the highest risk of people who may have experienced these integration events are those with these turbo cancers, these stage 4 rare sudden onset cancers, particularly in young individuals.
Yeah, I think the young individual or multi boosters, that stuff would be certainly indicative of a smoking gun. What about Dr. Sun Xiong's theory that the spike is knocking out natural killer cell function, and that those scavenger cells for cancer are the reason we're seeing the uptick in cancer, if indeed we are? I'm not even sure there's agreement about that yet, but what is your theory on that hypothesis?
Yes, the spike protein does appear to inhibit tumor suppressor genes, right? P53 and BRCA. But most recently, and it was just preliminary accepted for publication, we identified exactly what happens molecularly in those who develop new onset cancers after the shots. So actually, thousands of genes become dysregulated compared to a healthy control group. We found literally genes related to essential immune function, genes related to mitochondrial function, and genes related as well to cancer surveillance. They were literally being turned off. And so we are seeing this with this mRNA technology, probably as well with infection in some circumstances when they are super loaded with the synthetic and manufactured spike protein, right? So this is all a bad thing. But we have to remember the very first population study that looked at COVID vaccines and cancer came out a month ago, and they found the COVID vaccines increased the risk of any cancer by about 23%. And they looked at over 300,000 Italians, followed them for 30 months. But they also found increases, about 50% increased risk of breast cancer, colorectal cancer, leukemia, lymphoma, all these cancers were increased in the vaccinated population. So we now have the population signals, and now we have these mechanistic signals. It's clear these shots unleashed the turbo cancer epidemic.
These genomic observations you're referencing, that is high level technology. It's high level stuff. Is it expensive, and how are you able to do that, and should we be doing more of that?
Yes, well, laboratories that can do genetic sequencing, they should be able to look for this. If they can process, biospecimens and and literally just do the sequencing, they can look at reference sequences of Pfizer and Moderna plasmids and try and match it. So many labs across the country will have the capacity to do this, and they should be doing this because it is that important, right? Everybody's been raising the alarm this could happen for so long. Now it appears that it is indeed confirmed. We do need more testing to really dig down into this. And we have to remember, this might transfer to offspring. And that could be why we're seeing this excess infant mortality crisis in 2025.
I hate to think that. Do you have any thoughts about how the HHS is plodding ahead with? I know they're moving on many fronts. I believe they're trying to do this all in good faith. Do you have any thoughts or criticism of the approaches they're taking? Because I hear a lot of Maha complaining, but I keep saying, give them time. Give them time. This material is not fast to do this work, and you have to find your targets, and you have to do the work. It takes quite a while.
Right. No, I'm pretty happy, right? I'm pretty happy. I think, especially when we looked at that autism announcement a few days ago, nobody was expecting Trump to talk about vaccines. All the media reporting was claiming everything would be pinned on Tylenol. That was false. Trump literally talked for 5 minutes about how they pump in, 70 doses into beautiful babies. He said it's a travesty. So yeah, I'm happy with that for sure. I'm happy they canceled the 20 mRNA injection contracts. I'm happy with what they're doing. They're moving kind of at a snail's pace, but imagine what would happen with the other administrations. We would be in a disaster right now.
Oh my God, yes. They're being careful, I think, and they're being thorough, and they're trying to use world-class science. And when I said that, Naomi bristled because she has world-class science and is upset that that's not being observed carefully. But I think we got to give them time. We got to let them do their thing. Back to HHS. Do you have an opinion on the CDC director having been fired?
Yeah, so now that Monterez is out, right, she revealed herself as a vaccine cartel collaborator, right? She was just the vaccine ideologue, didn't want to say anything bad about vaccines, and would have been a very large obstacle in addressing all of these issues we're seeing. So I think it's a great thing she's out, right? All these the Satanists are out, right? It was just crazy who was in the CDC. And so finally the restructuring has begun. Hopefully they are replaced with people who are not compromised and would like to do real science. And so this is a big change, but yeah, we have yet to see any replacements really so far.
What's coming up for you? What kind of stuff are you working on?
Oh, we're working on the largest ever, one of the largest analyses on the possible causes of autism. And so we've identified over 10 risk factors. There's so many different contributing factors to autism, but, and I'll give some preliminary data we've already identified where there's over 100 studies that find a positive association between vaccines and neurodevelopmental disorders and autism. Over 100. There's only about 30 that claim there's no association. And so we tipped the scales of balance there. It's looking like these vaccines are a risk factor for autism. It's very clear now.
We got to figure out which ones and what sequence and when and all. There's so many things to be worked out here. But I got to say, I'll occasionally fish around in the medical literature, and I was looking around at some of the earlier animal studies trying to make an association with autism and several different vaccines. I was shocked how many animal studies had clear biological evidence. I mean, they were sectioned brains afterwards where you're like, there it is. It's like this inflammatory response is in the regions that we've been concerned about. And that data has been around for a long time. I got to tell you, I was shocked. Have you seen all that literature?
Yeah. And that's the thing. All the mechanistic literature, experimental testing on these animals all reveals that this can happen. This can cause neurological damage. This can cause autism-like behaviors. Yeah. And so now the side that says there's no possibility at all and we have to forget about it, they're not supported by any mechanistic or biological evidence. And when, literally. The evidence is in favor. These vaccines are a risk factor, along with many other things. We have the gut-brain axis, microbiome. That's a big role. Maternal immune activation, genetics, right? Environmental exposures, pesticides. So many things play a role as well.
Yeah, we've got, thankfully, we're finally starting to tease this all apart. But it is much bigger than people imagine, I think, in terms of figuring out what's what. I mean, even just figuring out, vaccine versus COVID versus both, just those sorts of teasing that apart is just by itself kind of challenging sometimes. And then what are the implications of, I don't know, there's a lot of questions to be asked, but I'm just I feel like the right guys are in charge to shepherd us forward in this manner. Are they turning to you for any guidance or any scientific work?
I have. We've provided some direct things to some people in HHS, and that's why I'm confident and positive about our future, because I am directly aware there's so many people at high levels in HHS that do want to see an end to this garbage. They do want to see an end to this mRNA technology. It's there, right? They are good people. They want to make positive changes. They're not evil, right? These are good people in charge at HHS.
Yeah. And they're kind of like me. They don't want to throw the baby out with the bathwater, and that's why they're being cautious. And they want to have doctors to have things available to them if the risk reward is warranted. But you can only know that if you do the science first. So here we are. Nick, I appreciate the work you're doing. Where do you want people to find you?
Yes, you can follow me on X at Nick Hulscher. Also, Focal Points, thefocalpoints.com.
Got it. That seemed like a new site. What's that about?
It's the same site. That's just our Substack. That's with Dr. McCullough, John Leake. That's where we post all of our daily articles. It used to be Courageous Discourse, but we changed it.
Right. Okay. That's what I recall. All right. Thank you so much, Nick. We'll talk again soon, no doubt.
Thanks for having me.
Now, tomorrow, Caleb, help me. We are going to be early, right?
Susan, yes. Susan's going to have to answer that because it changed 4 times right before the show. I'm not exactly sure who's coming in.
No, it's tomorrow. He was busy prepping today's show, but it's tomorrow at 11:30
a.m. Pacific.
Yes.
So that is 2:30 Eastern. Tell me more.
And
I believe
we're
it's
going to have Dave Rubin.
Yes.
And then Jack I always say his name.
Posobiec.
Oh, good.
Okay. So Poso's coming in. Yeah. So I'm going to be doing Actual Friends, I think is the name of the podcast, with Sage Steele and Dave Rubin tomorrow morning at 9:00. I think they are pretty much live, don't they?
I don't think so.
Anyway, it goes out pretty fast. And then Dave will be followed by Posobiec, who's really been an interesting voice these last few weeks.
We were supposed to have Bhattacharya, so we got Rubin because we had changed the time, and then Bhattacharya couldn't make it, so Dave said, I'll stay, and then Posobiec.
Which was nice. On the 30th, Andrei Burkhoff, who's a journalist in Europe, and I want to pick his brain about what's going on over there. He's been on fire. Jeff died. Is Jeff coming into the studio? He normally does.
I don't know.
And JP Sears, Jessica Rose, Dr. Latipo, and the First Lady from Florida, Casey DeSantis. Leyland Wittert from News Nation, Peter Navarro, Peter Galuli. We're going to have the whole family from TWC in on October 16th with Gary Brecka. So we appreciate you being here. Again, tomorrow is early. Set your clocks, 11:30 Pacific time, 2:30 Eastern. Let me quickly look at the restream. Thank you, guys. Kathy, we did do a show about autism. We had a doctor who was treating autism with stem cells quite successfully. He treated his own son, and it was for me, it was kind of a turning point. Cuomo called me less qualified than a recent college graduate. I don't remember that happening, but who knows? But that was a turning point for me in terms of the inflammatory theory about COVID. That was enough evidence for me. It's almost like Koch's postulates. Yep, we have a great lineup. Thank you, guys. All right, let me quickly look at the Rumble rants. You guys have been there. Susan, anything on the rants? Can't hear you.
Emily was just saying how Sobek has tweeted this is going to get worse reportedly over the last few years, and he's always right. That's
what is going to get worse? The violence?
Yeah.
So they're referencing the ICE violence and the. At what point are we going to stop the rhetoric that clearly induces violence? I don't understand. At some point, I guess people are going to have to be legally accountable if there's a direct link there, or at least attempts are going to have to be made to hold people legally accountable if there's something somebody says that is inflammatory and does dehumanize somebody and does call to everyone listening the notion of violence, and then somebody specifically takes violence and references that rhetoric. I think we have a case, and I think somebody's going to have to do it before this all stops, unfortunately. So thank you, guys. I'm watching you on the restream. And again, tomorrow, 11:30, Dave Rubin will be here early. We'll see you then. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.